guys, welcome back to the channel, and this is your last unit of OBG, that is chapter 12, Family Welfare Program. From this chapter you will get one question for 5 marks and two questions for 2 marks. 5 plus 2 plus 2, that is 9 marks. If you study this chapter you will be perfect with 9 marks. Come, let's start the chapter. Family Welfare Program. This program came into action so that they can provide a good health care to prevent the disease and to provide knowledge regarding the disease, signs and symptoms, and what are the treatment available for that, and to reduce the death rate and the disease rate. It focuses on the family members, but mainly on the vital family members. Those are the mother and the child. In mother, if you see, we have active plans like MMR, Safe Motherhood, ANC, and SIP, and many more, but these are the active plans. ANC is antenatal care. Antenatal care is nothing but the care provided to a pregnant woman at the time of pregnant till the delivery section. The care is provided is known as antenatal care. In this care we have regular checkups. In routine checkups we'll get to know how the baby is growing, is there any defect or not, how the mother's condition it is, like if mother has any disease or not, like underlying conditions, hypertension, BPs, like that. Those are ANC. In SIP, if you see, that is Sector Investment Program. In this program, the government provides money so that they can provide a good health care to the mothers in the rural areas. This two, ANC and SIP, are the minor programs. In this, the main program are MMR and Safe Motherhood. And next, in the child, if you see, RCH and ICDS. And the last one, population control programs, that is nothing but the family planning programs. The first topic is MMR, maternal mortality rate. This is nothing but the death rate of the mother during the delivery section. It is calculated by the number of living mother, those are in reproductive age, upon number of mother who are dead during the childbirth. If we calculate number of dead mother divided by number of living mother, we will get MMR. Causes of MMR: hemorrhage, sepsis, that is the infection in the blood, and underlying disease condition like hypertension and diabetes mellitus, thyroidism, miscarriages mostly above 3 months, prolonged labor, and then direct causes like consuming overdose drugs, like that, and indirect causes, the environment causes and the external causes. These are the causes by which the MMR is caused. And next we have preventive measures. How to prevent these conditions? First is finding the pregnancy earlier. If we detect the pregnancy earlier, so that we can provide the care to the baby in an early stage itself. After detecting, in the total pregnancy time, at least we need to visit the doctor for routine checkup at least for 3 times minimum. And then we should follow a good diet supplementaries recommended by the doctor, mainly to maintain the blood level, because the mother is providing blood to the baby, so mother may have a deficiency of blood, anemic condition can occur. And then in the routine checkup we will get to know, is there any risk condition present in the mother or any harmful condition that is present in the child. And next, treatment will be provided if there is any underlying disease conditions like hypertension, diabetes mellitus is detected. And then to prevent infection and hemorrhage is also medications will be provided. These are preventive measures. Next topic, Safe Motherhood. Here you, by the name itself, you will get to know that we will provide care to a mother, that is providing a care to a pregnant woman so that she can give a healthy birth. It is almost like the ANC. What the function performs by ANC, that is the function of this, like regular routine checkups, preventing the high risk pregnancies, providing a good dietaries, and keeping the mother healthy and the baby also healthy. That is the main aim. If we keep the mother and baby healthy, automatically the death rate and the disease rate of the mother and baby will be reduced. So there are 6 pillars to keep the mother safe. Like first is family planning. Family planning is not just like stopping the baby. In the family planning we can get more informations about how a healthy pregnancy can be followed, like planning the timing and spacing, mainly spacing in the sense how many years or how many months there should be a gap between one child to another. Normally 2 years gap between one child to other child is a healthy spacing. And next, antenatal care. Antenatal care, that is during the pregnancy time, regular screening, good healthy diet, walking, keeping away from the unhealthy environment. These are antenatal care. Next, obstetrical care, that is informing about the delivery process, how the pain occurs, and mostly what are the signs and symptoms, minor problems seen during the obstetrical conditions. And next, postnatal care. Postnatal care is after delivery. After delivery also there will be lot of problem like infections and mainly lactation. How to feed the baby, to not follow bottle feeding, the breastfeeding should be given, how many years it should be given, and what are the foods can be given to the baby, techniques of lactation, and then how a mother can stay healthy, how a mother can prevent the infections and depression, her mental condition, because of hormone falling down suddenly she'll be affected mentally also. For that also in postnatal care we will provide care. And then post abortional care, this is mainly for the emotional support. Because of abortion the mother will be disturbed psychologically more. Here we'll provide care for that. And then at last we have in routine examination we will try to prevent the sexually transmitted disease from the mother to the child. These are the pillars to keep the mother and the baby safe. In maternal health we have been completed MMR and safe motherhood. While now in child section we have RCH and ICDS. RCH full form reproductive child health. This program mainly concentrate on providing health care, providing knowledge, and preventing the death rate and disease rate, and preventing the illness in the mother, infant and the child. It was launched in October. As I said, it belongs to child section. Why we are concentrating on the mother? It's because generally mother is provided care during the time of pregnancy. If you provide care to the mother, then automatically the baby will be healthy. So that's why mother is included in this program. Components of RCH: preventing the unwanted pregnancies, like if the baby which is present in the womb has some kind of defect, or it is having a congenital malformation and we have been found it very early stage, then the doctor will advise to undergo the abortion. So like that unwanted pregnancy will be eliminated. And the mother care during the pregnancy condition, during the delivery and after the delivery. In 3 stages also the care should be provided effectively. And child survey, this survey is useful in the case of providing vaccines on time, or to find what is the disease rate and death rate and illness rate in the child. And management of reproductive tract infection and sexually transmitted infections, and providing knowledge about it and management will be provided here. And a referral system, it is a unit which provide knowledge and people can contact them and ask whatever the doubt they have. They provide a referral unit for that. And reproductive service for adults on age also. And then sexuality, gender information, education, counseling, treatment will be provided here in the RCH. And next we have ICDS scheme, that is Integrated Child Development Scheme. And this scheme has been came into our community very earlier in the October month itself. And this scheme mainly concentrates on the malnutrition kids, how to reduce the death rate and disease rate of the child, and how to promote the children to go to school, how to promote the education level in the children. That is what this scheme is focusing on. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.